Hello, everyone. Today at secondstreet.org, we have Leanna Christie and Christy Yvonne from Health Vantis. It is my understanding that you ladies started Health Vantis out of genuine desire to help those Canadians that feel stuck with their current healthcare options. So for those of you who haven't seen your previous interview with you guys, could you tell us a little bit more about your company?
Yes, thank you, Heidi, for an opportunity. We're so happy to be here today. The reason we started our company kind of goes back a little bit. We were friends before we started this business. Our sons went to the same school, so we were at pickup and drop off every day, and we both lived in the US before. So as we were talking, we came to share stories of how challenging it could be to get healthcare in Canada. We weren't even talking about surgeries at the time. For example, a GYN exam, a women's well exam would take up to 6 months wait. Like a shoulder ultrasound would be anywhere from 4 to 10 months wait. And there were no family doctors in Nova Scotia that were taking new patients. And back then, Christy shared this story with me that was quite unnerving to me, at least, about the troubles that she encountered when her son was an infant. And all of a sudden, her son stopped gaining weight and he started losing weight. So she tried the walk-in clinic. She couldn't get a family doctor. And so she ended up taking him back to the US for a diagnosis and treatment. And so we just thought that this is not a good way to deal with your health issues. And we thought, well, what about those people that don't want to wait? Maybe they want to go somewhere else. So we started exploring the area of medical travel and came across this whole industry called medical tourism. And that's what medical tourism is. It's traveling outside of your local area to get healthcare somewhere else. So we kind of learned a little bit more and spent a little bit more time exploring. Going to the US to get healthcare can be complicated simply because there's so many price differences and it's not easy when it comes to affordability. So anyway, after a little bit of time, we've decided trustworthy, affordable, timely and reliable private treatments and surgeries for Canadians.
That's fantastic. And Christy, just talking to your point, so I know that must be a very impassioned, organization to start for yourself because it's so personal. So would you like to tell us a little bit about your son and your journey with this?
Yeah, it's kind of like what, Leanna was saying. He was an infant and all of a sudden was just not gaining weight. He wouldn't eat, and then he obviously wasn't gaining weight, and then he started losing it. And I tried to find a doctor for him to go to, and no one was taking new patients. I basically had to go to a walk-in clinic, and finally, a friend had kind of taken mercy on me and asked her family physician if they would take us on, and she did, thankfully. But even after that, just, to get the treatment, or even a diagnosis through a pediatrician was becoming very difficult. And after 6 months of it, I eventually took him to the US, and he was in, to a GI doctor the very next day after seeing the pediatrician. And we had a diagnosis. And quite honestly, it was something very simple, very treatable, very easy, and very common. He had reflux. Out of all things, it was just internal. And obviously a baby can't tell you that it hurts when they eat. And that's what was going on. But it's something that's very, very common and should have been, spotted like right away. But it was a 6-month process. So yeah, it's obviously became very personal and, makes you not want to trust, the healthcare system that they're going to help you when you need it. And that's, kind of where, where I started everything. And, and once we started talking about it, was like, what do other people do? And where we came up, with the idea to start our business. So.
Totally. And, that must be such a scary process as a mom, because before the diagnosis, you don't know. And
Right.
it's always hindsight now, but
Mhm.
you just, in those situations, like you said, it's, you're trying to fight for your child and all you know is your child's not gaining weight.
Yeah, it was very difficult. And I was fairly new in Halifax, so I didn't really have a support system there either. And it's just but yeah, it can become personal, especially when it's your child.
Totally.
Yeah.
So when we last spoke, ladies, it was before COVID. So what has changed on your end since COVID emerged in Canada?
Uh, Honestly, one of the biggest changes or challenges that we've had is the travel part of it. There's obviously been a ban against traveling, and they do now consider traveling for medical purposes essential. So you can do that. However, there's still a lot of hoops that you have to jump through. It's not as easy as just getting on a plane and going somewhere. There's a lot of protocol and rules that have to be followed. And then back in January, Canada imposed even more rules when it comes to flying to and from places. And there's not a lot of options in Canada in the way of private facilities. And so, a lot of people that we help do end up going to the US. But now with this added element of, all these other things that you have to do, it certainly has become a lot more challenging, for us. And it becomes a bigger deal to somebody as well, a bigger investment in their time and money, because now when you come back, you have to have the COVID test before you get on the plane. And then when you get back to Canada, you have to have another one, and you have to quarantine in a government approved hotel for 3 days. And then you go home to finish the rest of your quarantine. And that's after, you've done, followed the rules at the state that you went to in the US. And, after having a surgery, or like a major procedure or something. So it can kind of become a hassle. So that's the biggest thing, that we've noticed. And then also, just the delays, in getting treatment, it certainly has increased for sure. So,
Absolutely.
yeah.
So are there any stories of Canadian patients that stand out to you in your mind over the years? Things that, there's just certain patient stories that we connect with or that you thought were really interesting or really showcase the Canadian versus the American healthcare options?
Yes, and we do have a couple of stories, and without getting into too many details in each of them, I am always amazed at the lengths that Canadians would go to fix their health issue. And I'm not just talking about physical distance, it's also mental health and mental stamina to take this journey. For example, we had a patient who was experiencing issues with their health and couldn't get in privately or publicly here in New Brunswick. And they reached out to us asking for help. So we work with a facility in Arizona. But for that person to have surgery, she had to have a diagnostic treatment. So that was some months away for the person here in New Brunswick again. So we arranged everything for her to fly to Arizona from New Brunswick, which is at least 2 stops at the time. It was during holiday time in December. So they had to put their family on hold and holiday time on hold just to address this issue. She ended up going successfully, getting the diagnosis. She was recommended the surgery that she was asking for, getting the surgery done, staying for a little bit of recovery time, and then coming back to New Brunswick and isolating for 14 days. Again, that was Christmas time. A lot of family time was missed to it, but just the lengths of this family that decided to get it done. And she's not the only one that does that. One of our latest clients decided to go to Toronto also during COVID times. But when he tried to address his issues in the public system, it was up to 20 weeks of wait just to see an orthopedic surgeon. When he brought this up with his mom, who is 86 years old, she said, well, you could be dead before you get your foot fixed. So he decided to go during COVID, again, take his companion, his wife with him, stay there for close to a little bit over 2 weeks so that he can see the surgeon post-surgery to make sure everything was good and recovered. And so people make great sacrifices. Neither of these families are wealthy families or ultra wealthy, or they're just concerned that they will not get help here. We also have another person flying from Newfoundland to Edmonton for a diagnostic test, which is not the closest place to fly, but that's a way for the person to get this done so she can get treatment.
And that's really interesting because when it comes to your health, this is one thing that we all know is that if you do have a health problem or it affects your family, it is serious and you do need to address it. And that's one of the things that you have to do to get the problem solved. And I'm sure that most Canadians are feeling that way. So I'm kind of curious, from Canada as an aging population, especially in the Maritimes, it's a reality that as we get older, we require more and more health services. So this problem has been known for years, but we don't see anyone doing anything about it. Has our nation's aging population affected your company at all?
Honestly, not really. I mean, not us personally, but, we definitely do get, a lot of middle-aged, customers or people contacting us, a lot of baby boomers. But, as far as like elective surgeries go, like when we started our business a few years ago, the wait times obviously were pretty long. And, every year that passes by, they keep getting longer and longer and longer. And so it is going to become a major issue for these individuals, at some point. And, some of the other things like, acute issues or chronic diseases, things like that, like those are things that we're not going to see. We're going to see people that are on wait lists for surgeries and things like that. But, they kind of fall into that same category that I fell into of, they may not even have a family doctor because there just simply is not enough of them out there. And, for them to be treated in a timely manner is really going to be a challenge. Yeah.
Totally.
And I just want to add that it is unfortunate because as a young person, you're contributing through your taxes, through healthcare, and the expectation for any young person that when you do get older, when you do get sicker and need help, the expectation is that you will get help in a timely manner. But unfortunately, that's not what happens all the time.
Absolutely. You're totally correct on that. So you follow healthcare issues closely in Canada and you speak with patients on a regular basis. What do you think needs to change? What would you do differently if you were the Minister of Health?
Well, we hear this from people over and over that Canadian healthcare needs to be more accessible and that rationing healthcare is not fair to any Canadian. And like I said, especially to our aging population, because they would probably be the most vulnerable. And so I think healthcare in Canada just needs, in general, needs to be more open to a possibility of reform and change. But it is becoming a political issue and it's becoming a very divisive issue for the country. At least that's my feeling on it. And so it is a tough question to answer. But, if you would take a first step and look at addressing the healthcare inefficiencies, perhaps evaluating how funding is done. Is it based on quality and performance? Is it based on numbers of people that doctors and hospitals are seeing? And, possibility of a private option without affecting those that are more vulnerable more vulnerable people in our population. So those are the things that I would definitely consider, but something else to know as a Minister of Health would be like, where does the money go now? Is it spent the way that we're supposed to spend it? Is it addressing the issue that we're asking it to address? So those would be things to consider, I think.
Absolutely. And Christy, what are your thoughts on this?
Yeah, very similar, to what, Leanna has said. Another thing too, that a lot of other countries do that have similar, healthcare systems is that, they have things like copays, for instance, and that seems to keep ER visits down. Someone's less likely to go to an ER and possibly wait until the next day to get into their doctor or a walk-in clinic if it's closed. If they have to do a copay, so there's things like that that could be done or allowed, and kind of to like piggyback off of that as well, the healthcare system doesn't obviously allow for the privatization, and it's thought that only wealthy people can afford it. I'm not quite sure where that information is based off of. If it's factual data that's been collected or what, but like in our experience, the people that we've helped are mainly middle-class individuals. It's a huge decision for them. It's a huge sacrifice, and I'm just not quite sure, where that came from, but it's certainly not what we see as a company. One of our clients had actually recently had told us as well, she went to the States to have a hip replacement done. And she goes, I could have bought a new car, but I got a new hip instead. And she's obviously not regretted, that decision. So even just the thought of being able to allow the, private clinics to open and have that access, if it's something that you choose to do, I think would help things out tremendously. And it's, other countries, it's shown that it does, it has helped. So, yeah.
Absolutely. I think those are great points, ladies, because, United States is only one model of healthcare system. There's many others around the world. And it is interesting that Canadians really are nervous about looking at alternatives or improving the system that we have and creating more options for patients. Because it's clear that there are issues that are arising and have been arising for quite a few decades. So is there anything else you guys would like to add? And how can patients get a hold of you or individuals across Canada? What's the best way to reach out to Health Vantis?
You can reach us. We have a toll-free number. It's 877-344-3544. We also have a website. You can fill out a contact form there. The website is www.healthvantis.com. And you can also send us an email at info@healthvantis.com.
Perfect.
So, yeah.
Well, thank you, ladies, so much for coming on. It was a pleasure. I learned a lot, and just keep up the great work. I think what you guys do is incredibly important, and giving patients the options to really address their health needs. So again, thank you.
Yeah, thanks so much, Heidi. It was a pleasure.
Bye. Have a great day.
You too. Bye-bye.